My name is Aarya Ramprasad, and I will be presenting on behalf of my team for our poster, Radiological Imaging, the Physical Exam of the 21st Century, How Innovations in Imaging are Leading to Stronger Diagnoses. So physical exams have been used since the mid-1700s, starting with percussion on the patient's body to allow for a deeper understanding. Technology has allowed us to find ways of seeing within the body without the use of invasive techniques to gain a better understanding of pathological processes. From 1997 to 2006, CT imaging has doubled in use and MRI use has tripled. These trends continue with patient numbers increasing and easier accessibility to more advanced technology. Though the physical exam continues to play a critical part in medical diagnoses via percussion and palpation that helps provide a visual map in a healthcare provider's head, there are still many things that are difficult to visualize due to their depth or location in the human body. We continue to see a shift towards using imaging for reinforcement of the physical exam, alongside additional details that may not be possible to understand solely through the physical exam. In our study, we aim to determine the view from practicing radiologists on how imaging plays a part in patient care and how they believed the shift they saw would play a part in future healthcare motives. So for our methodology, we sent surveys, including multiple questions, to 200 radiologists asking their thoughts about the push towards increased use of imaging in the medical field. The questions included the following. Number 1. Do you believe there is a push towards more imaging use in the developing differential diagnoses? Yes or no? Number 2. If yes, why do you think there is an increasing demand for imaging being incorporated into patient care? Number 3. If yes to question 1, do you think that this trend will continue? Each response received from a physician was analyzed by our team to compile the most frequent answers aside from the objective answers of yes or no for questions 1 and 3. So for our results, out of the 200 radiologists that we sent surveys to, we enjoyed a high response rate of 184 responses, which was a 92% response rate. For the first question of our survey, 182 respondents stated that they did believe there was a push towards more imaging, while 2 stated that they did not believe so. For the third question of our survey, all 182 respondents who had stated yes towards question 1 also stated yes towards believing that the trend towards pushing for more imaging would continue in the future. The results for question 2 are spoken more on in the discussion section. So, our results showed that almost all of our respondents believed that there was a push towards more imaging in the healthcare environment. For the second question, many of our responses discussed why they believed this change was occurring. One popular answer included that many people believed that there was more objective information in imaging versus a physical exam, which can sometimes be interpreted differently with different physicians. Many clarified that the differences in examination via physical exam may not be drastic between physicians, but with continued training in the field of radiology and higher rates of fellowships being completed, many radiologists are becoming better and more efficient at reading at a standardized level across the country. Another answer included that imaging allows for early detection of certain medical conditions such as cancer due to its specificity for finding smaller items within the body. These techniques are also less invasive, which can lead to long-term reduction of costs with less procedures and an earlier diagnosis rate. Many physicians stated that there should not be an eradication of the physical exam, but a strong and continued effort towards incorporating imaging with the physical exam for a reinforcement towards a final diagnosis. This allows for many physicians to be more confident in their diagnosis due to similar findings being examined by 2 methods. Though many physicians did vouch for continued use of imaging, they did state that imaging is not the say-all or one answer for every condition, with its limitations including quality of the radiograph, higher costs for less benign syndromes, and the use of higher ionizing radiation with increased frequency. We do hope that these findings and discussions from professionals can help provide insight on how the field of radiology and imaging is evolving as a supporter to what has been a basis for medicine for years and will continue to grow in its efficacy and accuracy. Thank you so much for your attention, and I would love to take any questions that you have now.